Hello students, welcome to this session on hypersensitivity. Hypersensitivity is the injury's consequences in the sensitized host following subsequent contact with specific antigen. So there are total four types of hypersensitivity reactions: type 1, type 2, type 3, type 4. Jane and Coons classification. So there are total four types. Human immune response in type 1 is humoral, type 2 humoral, type 3 humoral, type 4 cell mediated. The type 1 immediate, type 2 immediate, type 3 immediate, type 4 delayed. Duration in type 1 is 2 minutes to 30 minutes, type 2 is 5 to 8 hours, type 3 is 2 to 8 hours, type 4 is 24 to 72 hours. Mediator type 1 IgE, type 2 IgG, type 3 antigen antibody complex, type 4 PDTH cell. Effector mechanism type 1 mast cell degranulation, type 2 ADCC complement mediated cytolysis, type 3 complement activation inflammatory response, type 4 macrophage activation leads to phagocytosis or cell cytotoxicity. Desensitization to the allergen, type 1 easy but short lasting, type 2 easy but short lasting, type 3 easy but short lasting, type 4 difficult but sustained. Typical manifestations: type 1 anaphylaxis, asthma, atopic dermatitis. Type 2 transfusion reactions, RH incompatibility, hemolytic anemia. Type 3 Arthur's reaction, serum sickness, glomerulonephritis, rheumatoid arthritis. Type 4 tuberculin test, granuloma formation in tuberculosis, leprosy, contact dermatitis. Type 1 hypersensitivity reaction, production of IgE by sensitized B cells following a contact with an allergen, which in turn induces mast cell degranulation. These changes ultimately lead to localized response called as atopy, systemic response called as anaphylaxis. Experiments to demonstrate type 1 hypersensitivity reaction, PK reaction, Schultz-Dale phenomenon, and Thibault-Smith phenomenon. PK reaction. K. Prosnitz and H. Kussner in 1921 injected serum from an allergic person into non-allergic individual intradermally. When the appropriate antigen was injected at the same time, a wheel and flare reaction analogous to hives developed at the site. First, to demonstrate antibodies in the serum are responsible for the allergy and it is transferable from one person to another. Wheel flare response occurs in three stages: appearance of an erythematous area at the site of injury, development of a flare erythema surrounding the site, wheel swelling and congestion forms at the site as fluid leaks under the skin from the surrounding capillaries. Schultz-Dale phenomenon demonstrate anaphylaxis in vitro by exposing isolated tissues such as intestine or muscle segments of sensitized guinea pigs to the allergens. Mechanism of type 1 hypersensitivity. So there are two phases: sensitization phase and effector phase, both occurring with an interval of 2 to 3 weeks. Sensitization phase. Sensitization is most effective. Allergen is introduced parenterally but may occur by any route, including ingestion or inhalation. In susceptible individuals, very minute doses can be sufficient to sensitize the host. Allergen is processed by antigen presenting cells and the antigenic peptides are presented to the CD4 helper T cells. Activated Th cells are differentiated into Th2 cells, which in turn secrete interleukin 4, induces B cells to differentiate into IgE producing plasma cells and memory cells. Secreted IgE migrate to target sites and coat on the surface of mast cells and basophils. Fc region, the CH3 and CH4 domains of IgE binds to high affinity Fc receptors present on mast cell surface. Such sensitized mast cells coated with IgE will be waiting for interaction with the subsequent antigenic challenge. When same allergen is introduced subsequently, shocking dose, it directly encounters with the FAB region of IgE coated on mast cells. IgE cross-linkage initiates degranulation. Allergen bound to IgE triggers the mast cells and basophils activation and degranulation. Granules in turn release a number of pharmacologically active chemical mediators that lead to various manifestations of type 1 reaction. Memory B cells further differentiate into plasma cells that supply IgE. Effector phase, degranulation in two phases. So first, primary mediators, the preformed chemical mediators which are already synthesized by mast cells are immediately released. So examples, histamine, heparin, serotonin. So they increase vascular permeability, increase smooth muscle contraction. Eosinophil chemotaxis factor, eosinophil chemotaxis. Neutrophil chemotaxis factor, neutrophil chemotaxis. Proteases bronchial mucus secretion, degradation of blood vessel basement membrane. Secondary mediators are those which the mast cells synthesize and release. So the pharmacological actions, chemical mediators increase bronchial and other smooth muscle contraction, increase vascular permeability and vasodilation. And the symptoms are breathlessness, hypertension and shock leading to death at times. So the examples are platelet activating factors, leukotrienes, that is slow reactive substance of anaphylaxis, prostaglandins, bradykinin, cytokines, example interleukin-1, tumor necrosis factor alpha. So they cause systemic anaphylaxis, increase expression of cell adhesion molecules on venular endothelial cells. The mechanism, allergen gets exposed to APC, that is antigen processing cell, then that is CD4 plus T helper cells differentiated into T helper 2 cells, then T helper 2 cells then secretes interleukin 4, then which sensitize B cells, then B cells converted into memory cell and plasma cell. The plasma cell allergen specific IgE allergen. So they get sensitized mast cells and then re-exposure to allergen they cause degranulation. So primary and secondary mediators are released and they cause smooth muscle contraction, blood vessel dilatation, platelet degranulation, then sensory nerve endings, eosinophil secretion. Manifestations of type 1 reaction. So first, systemic anaphylaxis, acute medical emergency condition characterized by severe dyspnea, hypertension and vascular collapse leading to death. Occurs within minutes of exposure to allergen and unless treated promptly may lead to fatality. Epinephrine adrenaline is the drug of choice for systemic anaphylactic reactions. Second, localized anaphylaxis, also called atopy. Reaction is limited to specific target tissue or organ, mostly epithelial surfaces at the entry site of allergen, mostly run in families, that is inherited. Examples, allergic rhinitis and asthma. Allergic rhinitis or hay fever, most common atopic disorder, results from exposure to airborne allergens with the conjunctiva and nasal mucosa, leading to appearance of various symptoms such as watery secretion of the conjunctiva, nasal mucosa and upper respiratory tract, as well as sneezing and coughing. Asthma, second most common atopic manifestation, differs from hay fever in involvement of lower respiratory mucosa, resulting in contraction of the bronchial smooth muscles and airway edema, increased mucus secretion, altogether leading to bronchoconstriction and dyspnea. The stimulus may or may not be the allergen. According to asthma classified, one allergic asthma induced by airborne or bloodborne allergens such as pollen, dust, fumes, insect products, or viral antigens. Intrinsic asthma, it is independent of allergen stimulation induced by exercise or cold, food allergy, atopic dermatitis, allergic eczema, drug allergy. Various drugs such as penicillin sulfonamide may produce type 1 hypersensitivity response, which may be either local or sometimes produce systemic anaphylaxis. Detection of type 1 hypersensitivity. So skin prick test. So pricking the skin with required antigen. Advantage, skin test is relatively inexpensive and allows screening of large number of allergens at one time. Disadvantage, it may occasionally sensitize the individual to new allergen and in some rare cases may induce late phase reaction or even systemic anaphylactic shock. Treatment of type 1 hypersensitivity reaction, avoidance of contact with known allergen, hypersensitization, monoclonal anti-IgG, IgE. So, antihistamines, epinephrine, adrenaline, cortisone, theophylline, chromoline, sodium. So, this blocks calcium influx into mast cells. Type 2 hypersensitivity reaction, host injury is mediated by antibodies IgG or rarely IgM, which interact with various types of antigens such as host cell surface antigens, extracellular matrix antigen, exogenous antigens absorbed on host cells, example drug coating on RBC membrane. Clinical conditions are transfusion reaction, erythroblastosis fetalis, autoimmune hemolytic anemia, agranulocytosis, thrombocytopenia, drug-induced hemolytic anemia, pemphigus vulgaris. Mechanism: antibody Fc activating complement system, antibody Fc interacting with Fc receptors on target cells, autoantibody mediated antibody dependent cellular dysfunction or ADCD. Type 3 hypersensitivity reaction occurs as a result of excess formation of immune complexes, that is antigen antibody complexes, which initiate an inflammatory response through activation of complement system, leading to tissue injury. Antigen involved immune complexes can involve exogenous antigens such as bacteria, viruses, and endogenous antigens such as DNA. Antigen-antibody immune complexes stimulate the classical pathway of complement, the products of which mediate the tissue injury in type 3 reaction. Anaphylactoxin chemoattractant. Role of neutrophils. Neutrophil fail to phagocytose large immune complexes. Mechanism of tissue injury. First is the platelet activation. Immune complexes bind to Fc receptor on platelets, leading to their activation. Platelet aggregation leads to microthrombi formation and vasoactive amines released from activated platelets, cause tissue ischemia, leading to further tissue damage. Activation of Hegman factor leads to activation of kinin, which in turn causes vasodilatation and edema. So type 3 hypersensitivity reaction. So first is localized and second generalized. So in localized, it is also called Arthur's reaction. It is defined as localized area of tissue necrosis due to vasculitis resulting from acute immune complex deposition at the site of inoculation of antigen. The reaction is produced experimentally by Arthurs in 1903 by injecting an antigen into the skin of previously immunized animal, that is rabbit. Circulating antibodies bind with the antigen in the dermis and form immune complexes, which leads to fix the complement localized immune complex mediated inflammatory response. That is called Arthur's reaction. So in skin following insect bite or during allergic desensitization treatment wherein repeated injections of the same antigen is given for long periods. In lungs following inhalation of bacteria, fungi, spores or proteins may produce intrapulmonary lesion. Examples include condition causing extrinsic allergic alveolitis such as farmer's lung or bird fancier's disease. Generalized or systemic type 3 reaction. Formation of small size soluble antigen antibody complexes following entry of large dose of antigen in body. Deposition of immune complexes in various tissues, initiating inflammatory reaction in various sites throughout the body, such as blood vessels, causes vasculitis, glomerular basement membrane causes glomerulonephritis, synovial membrane causes arthritis. Diseases associated with generalized type 3 hypersensitivity reactions. Connective tissue disorders due to autoantibodies forming immune complexes with self-antigen. Example, SLE, rheumatoid arthritis, antibody against human immunoglobulin, PAN, polyarthritis nodosa. Parasitic diseases resulting from immunocomplex deposition, nephrotic syndrome in Plasmodium malariae, Katayama fever in schistosomiasis, African trypanosomiasis. Bacterial diseases, Streptococcus pyogenes, post-streptococcal glomerulonephritis, Mycobacterial leprae, lepra reaction type 2. Viral diseases, hepatitis B, arthritis, hepatitis C, arthritis, infectious mononucleosis, Epstein-Barr virus, dengue, arthritis. Other hyperacute graft rejection, subacute bacterial endocarditis, serum sickness. Serum sickness seen following serum therapy, that is administration of foreign serum. Example, horse anti-tetanus serum to treat tetanus cases seen in the past. Horse serum proteins being foreign, they induce antibody formation in the host, leading to formation of large number of immune complexes. Typically, after 7 to 8 days, the individuals begin to show various manifestations which are collectively called as serum sickness. Type 4 hypersensitivity reaction differ from other types. It is delayed type occurs after 48 to 72 hours of the antigen exposure. It is cell mediated. Characteristic cells are TDTH, delayed type of hypersensitivity cells are principal mediators, and tissue injury occurs predominantly due to activated macrophages. Mechanism, there are two phases, sensitization phase and effector phase. So in this diagram, you can see in sensitization phase, there is APC, antigen presenting cells, intracellular bacteria. So there is formation of CD4 plus T helper cells, which leads to activation of the TDTH cells, and they secrete TH1 cells. Then in effector phase, these sensitized TDTH cells, they produce interferon alpha and tumor necrosis factor beta, and then there is resting macrophages which gets activated. So the sensitized PDTH cells secrete cytokines, that is interferon alpha, interleukin 2, TNF beta, then interleukin 3. Then these activated macrophages, they cause activation of class 2 MHC molecules, increase tumor necrosis factors receptors, oxygen radicals, and increase nitric oxide. Type 4HS, the first example is tuberculin test. So tuberculin test is the prototype delayed hypersensitivity in sensitive individuals who possess sensitized TDTS cells due to prior contact with M. tuberculosis. When preparation of tuberculin antigen and extract of M. tuberculosis is injected intradermally, there is local reaction development after 40 to 72 hours consisting of induration surrounded by erythema. And the interpretation, when less than 5 millimeter in duration it is negative, more than 5 millimeter it is borderline, but in immunosuppressed persons it is positive. 1 millimeter is positive in IV drug abusers, children under 4 years of old age, and people with high risk area. More than 15 millimeter in duration positive in the healthy person whose immune system is normal. Here you can see how the injection is given intradermally with help of tuberculin syringe, and then there is erythema and induration development after 48 hours of the injection. For hypersensitivity reaction, second example, contact dermatitis. Many antigens such as nickel, poison oak, etc. act by producing DTH response. Most of these substances are haptens. They complex with skin proteins which act as carrier to make the haptens immunogenic. This hapten skin protein complex is internalized by skin APCs, that is Langerhans cells, and then presented to TH cells to induce TDH reaction. Activated macrophages release lytic enzymes which result in skin lesions. Example, redness and pustule seen following contact with the poison oak. Examples of DTH, intracellular and contact antigens inducing DTH. Intracellular bacteria, example M. leprae, M. tuberculosis, Listeria, and Brucella abortus. Intracellular viruses, herpes simplex virus, variola, smallpox, mesovirus. Intracellular fungi, Pneumocystis jirovecii, Candida albicans, Histoplasma cryptococcus. Granuloma formation seen in tuberculosis, sarcoidosis, schistosomiasis, and other trematode infection, and lepra reaction type 1. Non-infectious conditions, diabetes mellitus type 1, multiple sclerosis, peripheral neuropathies, Hashimoto's thyroiditis, Crohn's disease, chronic transplant rejection, graft versus host disease. Contact dermatitis following exposure to contact antigens, nickel, poison ivy, poison oak, picril chloride. Skin test to demonstrate DTH, tuberculin test, that is Montagu's test, lepromin test, Montague test in leishmaniasis, and Fry's test in done in LGV. To summarize, hypersensitivity reactions, there are mainly two types, immediate and delayed. So immediate are type 1, 2, 3, and delayed is the type 4. And then type 1 is IgE mediated within 2 to 30 minutes, and mediators are IgE and histamine. So examples, this reaction occurs when antigen binds to IgE on surface of mast cells. This produces release of mediators, histamine, serotonin, prostaglandins. Example, drug hypersensitivity, that is penicillin, anaphylaxis, hay fever, asthma, eczema. Type 2 antibody cytotoxic, and then time within 5 to 8 hours, mediators IgG. It occurs when antibody directed at antigens of cell membrane activates complement which damages cell membrane. Example, transfusion reaction, hemolytic disease of newborn, rheumatic fever. Type 3 immune complex mediated. Time is 2 to 8 hours, and mediator antigen antibody complex. Mechanism, it occurs when antigen antibody complexes induce inflammatory response in tissues. Example, rheumatoid arthritis, arthros reaction, serum sickness, arthritis, and glomerulonephritis. Type 4 cell mediated, occurs in 24 to 72 hours. Mediators are T cells, lymphokines, and macrophages. It is function of helper, that is CD4 T lymphocytes. Example, typical in test. When patient previously exposed to MTB is injected with small amount of tuberculin intradermally, there is little reaction in few hours. Gradual induration and redness develop in 40 to 72 hours. A positive skin test indicates that patient has been infected with agent. Example, contact dermatitis and tuberculosis.
Hope you find this session useful for your understanding and for your exams. Thank you.